Toxic chiropractic? Really? Can you have toxic release from chiropractic adjustments? Yes, you can. Chiropractic adjustments can lead to the release of certain biochemical substances, but not necessarily in a harmful way. Here's a breakdown of what happens. Chemicals released during a chiropractic adjustment include pro inflammatory cytokines like tissue necrotic factor alpha and interleukin 6. They may be released temporarily, especially in the case of chronic tension or inflammation. However, studies show that chiropractic care can actually reduce their levels over time. Another one that is released is lactic acid. It builds up inside muscles that have been under stress or in poor posture. Adjustments help release this, improving circulation and reducing soreness. Metabolic waste, such as urea and creatine, may be flushed out more efficiently due to improved lymphatic and blood flow. Another item is cellular debris from damaged or stressed tissues, which happens when you have what is called a subluxation in chiropractic. That's when your joints are stuck, unable to move, and tissues die and the fluids don't flow to remove them. And so the cellular debris from damaged or stressed tissues can be cleared more effectively after an adjustment. And stress hormones like cortisol and adrenaline may also shift as the nervous system recalibrates. So, temporary symptoms, aka a toxic release, some people experience a mild symptom after an adjustment, which are signs of the body detoxing and rebalancing. Maybe a headache, fatigue or drowsiness, muscle soreness, digestive changes, and mild feverish feelings. These effects are usually short lived and considered part of the healing process. Also, if you were in great pain when you came in for an adjustment, or if it's been a long time since your last adjustment, you may feel more sore before you feel more better. I like more better. So, the overall impact, rather than causing harm, chiropractic adjustments tend to reduce systemic inflammation and promote healing by restoring spinal alignment and improving nervous system function. If you're considering chiropractic care and are concerned about these effects, it's a good idea to discuss your health history and the goals with a licensed chiropractor. During a chiropractic adjustment, the body responds with a cascade of neurochemical changes that include the release of hormones, neurotransmitters, and changes in inflammatory markers, and the clearance of metabolic waste products from these tissues. These effects are part of the body's natural response to the realignment of joints and the resulting changes in nerve signaling. The neurological and hormonal releases include endorphins. These are the body's natural good feeling and pain relieving chemicals. Spinal adjustments can stimulate the release of endorphins, which helps reduce pain perception and promotes a sense of relaxation and well being. Oxytocin is another release. This hormone promotes social bonding and is known for its calming and anti-inflammatory properties. Its release during an adjustment can contribute to reduced stress and enhanced well-being. Neurotensin, a pain-relieving hormone, is also released. Neurotensin release can help modulate pain and promote feelings of happiness by interacting with serotonin levels in the brain. Dopamine is also released, and it's involved in the brain's reward and pleasure centers. Its release can contribute to the buzz or sense of joy some people report after an adjustment. Cortisol, while some reports suggests a release of this stress hormone. More recent research on spinal manipulation in symptomatic patients found no significant change in cortisol levels. However, long term chiropractic care may actually help regulate the body's overall stress response by balancing the nervous system, which can in turn help cortisol levels reduce and stay in control. Serotonin is a key mood modulator. A balanced endocrine and nervous system can help stabilize serotonin levels, reducing anxiety and promoting well being. The effects on inflammation and metabolic waste are also beneficial. Chiropractic adjustments can help reduce the levels of pro inflammatory cytokines, those are messengers in the blood, and neuropeptides that contribute to pain and chronic inflammation. By restoring proper spinal alignment, the nervous system can better regulate the body's inflammatory responses. It also clears lactic acid. The tension in the muscles and the joints lead to a buildup of metabolic products like lactic acid. The manual manipulation of tissue during an adjustment can help increase blood flow and lymphatic drainage, assisting the body in flushing out this waste. And a gas release. The popping or cracking sound often associated with an adjustment is the release of gas, specifically carbon dioxide, from a joint's synovial fluid. While this is not a chemical release from the body's cells, it's a chemical process that occurs within a joint. And there's also a mind-body connection. And I would love to tell you about the mind-body connection. Those chemicals released in the brain have a profound effect on a person's mental and emotional state. The increased endorphins and oxytocin levels promote relaxation and reduce stress. For some patients, the release of physical tension can also manifest as an emotional release, which may lead to crying or other emotional responses, but most of the time, just a sense of peace and well-being. Chiropractic adjustments. Yes, they release some inflammatory cytokines when we move joints that have not moved in a long time, but it also has so many other benefits, releasing positive chemistry to help you along the way. I love to visit with you more about it. Feel free to reach out to the office, schedule an appointment online, or just message us. We will be glad to respond.